Madam Speaker, the Public Health Agency lost $150 million of taxpayer money on a failed contract. Wondering how it's possible to lose so much money? So are we, because the government refuses to say what the contract is, with whom, for what service, why it didn't work, and above all, why it did not demand to be reimbursed, since it got nothing for our money. Madam Speaker, Quebecers have a right to know. Who walked away with $150 million of public money without providing any services, and why? The Honourable Minister for Health. I remember at the start of the pandemic, it was a very difficult time for the country and for our people. At that time, it was necessary to make sure that all options were available. That's why we created agreements with many businesses that offered various types of vaccines, because it was impossible to know at that time who would be able to produce the right results. At the time, it was important to try every option. And that's the issue we're dealing with here today. The Honourable Member for Terrebonne. Madam Speaker, the government can't just cop out like that. The Parliamentary Budget Officer said the government should be able to provide at least some details, if not the name of the company. He also said that the loss of a $150 million contract clearly deserves an explanation. Madam Speaker, he's right. Quebecers do deserve an explanation. It's impossible that the government can't provide more details. So what happened with those $150 million? The Minister for Health. Madam Speaker, all details were available, not only to the Auditor General, but all the parties. Even the Bloc Québécois had a chance to see all the information. The process was related to measures for COVID-19. The information was available. At the beginning of the pandemic, it was extremely important for every option to be available. It was a reasonable action, and that is why Canada had the best pandemic response in the world.